Our news is brought to you by Alive.
Believe in best.
Good evening, Bahamas. Coming up tonight, one health expert warns Omicron appears milder but spreads rapidly. This, as the former health minister says, a high positivity rate means even higher cases that were not reported. Tributes pour in following the murder of Leon Griffin, and Bahamians reminded to focus on the Christ in Christmas. Merry Christmas and welcome to our news. Thanks for joining us. I'm Jared Higgs, topping news tonight. With COVID-19 cases spiking, infectious disease specialist Dr. Nakia Forbes is weighing in on the potential impact the latest variant could have countrywide. There are some positive signs, but also some real concerns about the impact the virus could have on the level of hospitalizations in the coming weeks.
Essentially, it appears as if the clinical features are milder than Delta. However, this is still being studied. That can't be said with absolute certainty yet.
Director of the National HIV, AIDS and Infectious Disease Program, Dr. Nakia Forbes, says there is early information that the Omicron variant, the latest and most dominant COVID strain worldwide, could be more mild than the Delta strain. On the other hand, though, Omicron is seen to be spreading far more rapidly, which Forbes says could nullify its generally more mild nature.
We will know more in the next few weeks as this continues to spread. Now, whenever there is a very, very contagious strain of COVID, like Omicron, what can happen is that because of the sheer numbers of cases, there can be increases in hospitalizations. And so in the United Kingdom and the United States, for example, there have been rises in hospitalizations. And we have to watch out for that and prepare our hospital and health system in case that does indeed happen.
There hasn't been official confirmation that the Omicron variant is in the Bahamas, but Prime Minister Philip Davis says officials are assuming that it is here and acting accordingly. As numbers spiked this week, with 140 cases reported on Wednesday and 159 cases reported on Thursday, hospitalizations remained relatively low at 18 and 19 on those respective days. Forbes says that's consistent with previous COVID spikes.
We know hospitalizations lag behind cases by about roughly 2 weeks. And so we are preparing and we will see what happens with the spike in cases and how that will or will not affect hospitalizations.
Forbes says Grand Bahama's hospitalizations did spike, but those patients had moderate symptoms and were all discharged. But with such a sharp increase in the amount of cases, there's a real concern about what those numbers will look like in the coming days.
All indications are that Omicron does cause record numbers of cases. So if Omicron is indeed here, we can expect that we will reach our record and pass our record.
Well, the actual number of cases out there is even higher than what is being reported, according to former Minister of Health, Dr. Dwayne Sands. He says the positivity rate on Thursday stood at around 25%, which tells him that not nearly enough people were tested.
So he had 159 positives out of 660 or so done. That's 24% positivity. That means that you didn't test anywhere near a representative number of people or an adequate number of people. And so there are countless more people in your community who are COVID positive right now.
Sands, like Dr. Forbes, is watching the data around the world and says he hopes Omicron does turn out to be more mild, but he also says it's too early to tell the full impact it will have on the population.
What happens as these people now go through the stages of their illness? We hope and pray that the likely culprit, the Omicron variant, has a mild clinical manifestation, but we don't know that yet. That may have been the experience in South Africa, but it certainly has not been the same experience in Europe and in the United States, where cases are up, hospitalizations are up, and deaths are up.
Detectives on New Providence are investigating the latest homicide here in the capital after a man was shot and killed on Quaco Street at around 8:30 on Christmas Eve. When officers arrived on scene, they found a man with gunshot wounds to the head. Paramedics pronounced the man dead on scene. Investigations revealed that the man was standing near a shortcut on Quaco Street when a man armed with a firearm approached and shot him in the head. The suspect fled the scene on foot. Meanwhile, 2 Jamaican nationals were arrested in Inagua on Christmas Eve after police say they found 34 sacks of cannabis near the shoreline there. According to reports, officers from DEU and the U.S. Coast Guard were on routine air patrols when they observed 2 men and a speedboat near the shoreline. The patrolling aircraft landed in the vicinity of the speedboat. When officers approached, they noticed a number of packages placed a short distance away from the men in bushes. A field sampling of the packages revealed a grassy substance suspected to be cannabis. The suspects, ages 50 and 34, were arrested and are assisting police with their investigation. Medical experts are urging caution this Christmas. Consultant Physician Staff Association President Sabrika Pinder-Butler says more Bahamians should practice personal responsibility while attending small and large gatherings. While she stressed that hosting and attending larger gatherings isn't a good idea, Pinder-Butler acknowledged that some people will do it anyway.
Certainly, if you're having events, make sure you're in touch with the Ministry of Health to know what protocols should be in place. And likewise with the Ministry of Health, I think that more things perhaps should come out from that level so that persons are aware of what they need to do should they be having these events. Perhaps we need to have persons even visit, if possible, these events to see what is happening even prior to the event taking place and during the event to make sure those measures are being adhered to.
As new COVID-19 cases return to the triple digits, the CPSA president says people should take precautions to protect themselves and their family this holiday season.
And so as citizens, we have to do the right thing. But this is a public health crisis. This is beyond just one person. This is beyond just small communities. This has, obviously, we should all know now, this has had a global impact, right? And so we have to start thinking about those types of things as we move forward with events, as we move forward to people trying to be safe. You know, we don't want to have more deaths and hospitalizations from COVID. We really, really, really don't. So, you know, while we are celebrating each other and attending different activities, we have to be mindful of those things that can safeguard all of us.
With the easily transmissible Omicron variant now labeled the most dominant strain of COVID-19, many countries, including the Bahamas, are now offering a third shot of the COVID-19 vaccine. However, some, like a top Pfizer executive, are suggesting a fourth shot may be needed. But is it a good idea?
About the recommendation of the Pfizer executive, we really cannot make any comment about that. We cannot rely on press briefings made by CEOs or companies. We need to have real scientific data. The scientific evidence will be the basis.
Earlier this month, Pfizer CEO Albert Bourla said people might need a fourth COVID-19 shot sooner than expected after preliminary research shows the new Omicron variant can undermine protective antibodies generated by the vaccine the company developed. However, PAHO's Assistant Director, Dr. Jarbas Barbosa, says the World Health Organization and PAHO have to rely on their own data.
They need to review scientific evidence. It's not a speculation for one person or other person. This will not provide good recommendation for the Ministry of Health, and maybe they will spread some confusion among the population. So it's better to wait to keep on vaccinating with the vaccines that are available, because they will protect against the Delta variant, that is the most predominant variant in the Americas.
Israel announced this week that it will begin rolling out a fourth dose of the coronavirus vaccine with immediate effect for people ages 60 and over, medical workers, and people with suppressed immune systems. So to come on our news, church and political leaders speak out on the death of Leon Griffin. and remembering the reason for the season. That's coming up when our news returns.
Welcome to our news and thanks for joining us. Topping news tonight.
COVID-19 remains a serious threat.
Coronavirus COVID-19 has disrupted our economy, tourism industry, educational system, and put our healthcare facilities and professionals on high alert. Are you prepared? Do you have all the facts? Stay tuned to this network for the very latest news and information on this global pandemic.
Tributes still coming in for the late Leon Griffin, husband of former cabinet minister Melanie Griffin, who was gunned down outside his home Thursday night. Christian Council President Bishop Delton Fernandez said he was a member of that community.
I am concerned. I am one of the community members of Rugby Drive, and I am a part of that neighborhood. And Brother Leon Griffin is a stellar person in our community. Our hearts are broken.
Free National Movement leader Michael Pintard also offering his condolences to the late businessman's family. In a statement, he said, "We wish to express our sincere condolences to Melanie and the entire Griffin family, as they are all in our thoughts and prayers. May God grant them peace in the midst of the tragedy and most unfortunate turn of events." Fernandez said the incident speaks to the social decay in the country.
It speaks to the decay in our society and the need for us as a society to come together and figure out, is this where we want our society to be? And move ourselves from this place of accepting these heinous murders to what can we do as a community to make our society better. So I give our condolences, not only as president of the Christian Council, as a Baptist, but as a neighbor. I give my condolences to Melanie and the family to let them know that we're praying for them as a Yamacraw community.
While Christmas may look and feel very different from what we're used to, Christian Council President Bishop Delton Fernandez is urging Bahamians to focus on the main reason for the season.
I want to say to us that we must focus on the Christ of Christmas and must also follow our protocols. One of the things we know, that if we wear our mask, if we vaccinate, if we follow the protocols that are in place, we will be safe. And I want to challenge us to just lift our guard, as I've challenged churches, and let's enjoy the Christ of Christmas and really give thanks for the gift that is Jesus Christ.
The Christmas season celebrates the birth of Jesus Christ, the Son of God. Fernandez urged Bahamians to remember this during gatherings and gift giving. When our news comes back from the break, it's not your Grammy's fruitcake, so whose is it? Christina Dragovich will tell us on the other side.
Welcome to our news and thanks for joining us. Topping news tonight.
COVID-19 remains a serious threat.
Coronavirus COVID-19 has disrupted our economy, tourism industry, educational system, and put our healthcare facilities and professionals on high alert. Are you prepared? Do you have all the facts? Stay tuned to this network for the very latest news and information on this global pandemic.
Welcome back to our news. It's a staple that you may find at the end of many Bahamian Christmas dinners, the fruitcake. But while traditional fruitcake may be the dessert of choice to some, one chef decided to take the ordinary and make it extraordinary. Christina Dragovich has the scoop.
What's sprinkled with sugar, soft and fruity? A different twist on fruitcake that has non-fruitcake fans doing flips.
I don't like Grammy's fruitcake. That was the problem. Okay, I never liked fruitcake.
Tessa Simone Lightbourne is the founder and pastry chef at Born Sweet, but she's no fan of a regular fruitcake, and she says that's exactly what drove her to whip up something new.
I wanted to make something for myself that I would like and people that didn't like fruitcake would enjoy, and that's basically what it is. We don't do any of the candied fruits in it. I know some people really, really like that, but I think they're gross, so we don't use any of them, all natural fruits. I won't say which ones they are, because some of them we cook down a little bit of it before we pour it into the batter, the fruits. So a little bit of them kind of like melt into the cake.
So the coconut fruit cake was born.
I soak year round, so as soon as the season ends, we get more fruit, put them in our bins, drop a bunch of Bacardi on there, and let them soak until we come around again. So that's one of the things. And then the second thing is the coconut cake that's baked on top. So crunchy on the top until we soak it in more rum, and it gets a little bit softer, of course, because it's sugar.
Lightborn began baking at a young age.
I used to bake bread with my Aunt Crystal every summer, and then it just went from there.
And turned her pastime into her business, a business she says has done surprisingly well during the pandemic, despite lockdowns and restrictions over the past 20 months.
And I think it's because the one thing we wanted to do during the pandemic was celebrate our birthdays. So people that probably wouldn't have spent as much on a cake decided they would spend a little bit more because that's like the only thing they could have done.
When it comes to the holidays, Lightborn says while her treats are delicious, nothing is sweeter than giving thanks and celebrating with those you love.
I want to say Merry Christmas to everybody and be grateful. Like, yeah, we have things that happen and we stress out, and I know I talk to a lot of people and they talk about how tired they are right now, how stressed they are right now, but there is always something good going on within that. So just take those moments, hold on to them, and also grateful for family and friends. Like, they are special. Keep them close.
Reporting for our news, I'm Christina Dragovich.
A Christmas greeting from the health minister. That's coming up when our news returns.
Welcome to our news and thanks for joining us. Topping news tonight.
COVID-19 remains a serious threat.
Coronavirus COVID-19 has disrupted our economy, tourism industry, educational system, and put our healthcare facilities and professionals on high alert. Are you prepared? Do you have all the facts? Stay tuned to this network for the very latest news and information on this global pandemic.
Minister of Health and Wellness Dr. Michael Darville wishing Bahamians a Merry Christmas in a pre-recorded Christmas message. Darville, who assumed the role of Minister of Health back in September, is urging Bahamians to remember the reason for the season.
As we celebrate this wonderful time of year with family and friends, let us remember the real reason for the season is to celebrate the birth of our Lord and Savior Jesus Christ. So in that same Christmas spirit, let us show brotherly love by reaching out to someone in our community who is in great need. On behalf of my wife and family, I would like to take this opportunity to wish the residents of Tall Pines, and by extension the entire country, a Merry Christmas and a prosperous New Year. Once again, I extend best wishes to you and your family.
Thank you for joining us for our news tonight. On behalf of the entire team, I am Jared Higgs. Have a Merry Christmas, Bahamas.